In a time when truth has been silenced and trust betrayed, one movement is breaking the silence. This is A Nation Betrayed, Unmasking the Hidden Agenda, presented by Betrayal Project USA. From deadly hospital protocols to coerced mandates to censorship, corruption, and cover ups, we expose the systems that profited from suffering and betrayed the American people. Join us as survivors, experts, and whistleblowers step forward to reveal the truth, demand accountability, and reclaim our freedom. Because silence is complicity, and the era of betrayal ends now. With us today, with me and Heidi Bond today, is Nurse Rena Maculins, who is a 20-year veteran of the nursing profession, specializing in case management and utilization review. The behind-the-scenes world where hospitals decide who gets admitted, what protocols are used, and how the billing codes are assigned. Based in Fresno, California, she became an eyewitness and whistleblower to what she described as one of the darkest chapters in modern healthcare. From falsified death certificates to padded COVID case counts to deadly hospital protocols and coercive vaccine mandates, Rena refused to stay silent. Her commitment to the principle of do no harm cost her everything: her job, her livelihood, her place in the community she served. Fired from multiple hospitals and blacklisted across major health networks, Rena now speaks out for those who are still trapped inside of a corrupted system. Her courage embodies the mission of the Betrayal Project USA to expose institutional betrayal and stand with victims and demand accountability. So thank you for being willing to come on here, Nurse Rena. We appreciate you. I'd like to start with, a little bit about your background and your calling into the healthcare field. So if you could tell us a little bit about your 20 years in nursing, what inspired you to go into healthcare, what your specialty was, and what your role was in case management.
Okay, so I went into nursing school 20 years ago after I was working with the US Navy. I came to America when I was 22, and my very first job was within the US Navy. I was doing like accounting, auditing. And then during that time, I had a fall down some steps, and I really hurt my back. I was really messed up, and I never really had any health problems until suddenly I'm having to go to doctors and physical therapists. And I was very impressed with the care back then. I tell you, the care back then was different to how it is now. And there was a nursing school in the town I was in, I was in Monterey at that time. And so I decided to leave the world of finance behind and go into nursing, because I felt like, I can work in an area which is just so gratifying. It's humanitarian type of job. And so I left the military and I went to nursing school because I felt I was so impressed, and it was not going to be cutthroat like the world of finance.
Yeah.
I went in with rose-colored spectacles. A little bit.
A little bit.
I thought it was the perfect thing and nothing could go wrong. It was the best choice. And so once I graduated, I did not plan to go into emergency medicine, but that's how I got into my residency in a level 1 trauma ER facility. And that's 10 years, I spent doing mostly emergency medicine, first as a staff, then I traveled across mostly Southern California, just multiple hospitals working in ERs. And it helped me to see people of many diverse backgrounds, especially in LA, where they have so many people from different countries having their own little towns and their own languages. And so that's when it became really interesting, because people of different backgrounds tend to have certain things, that maybe other locations you may not see. So it was interesting in that sense. I enjoyed it a lot, ER nursing, but it's hard on the body. And
Yeah.
so, yeah, after 10 years, I said, okay, I want to, shift gears, because I did have some injuries, especially when we had, really, really heavy patients. Like I had what really made me leave was when I had a patient who was almost 700 pounds kind of take my back out. And I was like, okay, how can I serve, patients in a different way? And I started searching. I managed to be a charge nurse in a blood bank. I was, let's see, I did home health a little bit for a little while. Then I was a supervisor in a skilled nursing facility for about a few years, and I got into case management. And I thought, oh, that's really interesting. I didn't know what they did, but I'm willing to go into this because it means I will not have to work so physically anymore. But with 10 to 15 years of experience,
Sure.
I can use it to manage the cases and help more people, because our caseload as a case manager tends to be about, in my experience, 40 to 80 patients on a given day. So I was given the opportunity to help so much more patients than the typical, like maybe 4 to 6 patients that a bedside nurse will have. And so I got to see a whole different side of nursing. And that's what kept me into it, because I felt, oh, I can do so much more now. And
Case management gave you kind of a unique vantage point on hospital operations and how that works.
it's
Correct?
just planning a lot you do. And back then, now they're splitting it. They're separating case management, which is the discharge planning, from the utilization management. But until last year, I was doing both. I realized that case managers are overwhelmed. We can't do both at the same time with that heavy caseload. We're never getting quality work done. And so thank God they've decided to split that. I know the Dignity hospitals have completely split the role, and they have like a hub. And so we can, as discharge planners, because I've worked with a lot of Dignity hospitals, you can give better quality of care and follow up and follow throughs, because you're not doing a whole different, role on top of another.
Yeah. Right. So that makes sense.
Mm.
So you have a vast, amount, a vast spectrum or breadth of experience, but also you have a view into how nursing has changed over the last couple decades, right? Like similar to my husband, he learned the old fashioned way of nursing, right? Where assessments, you actually had to look at somebody, touch somebody, take their vitals and do all of that. So at some point, you realized there were red flags, right? So at what point did you start seeing these red flags and knew something wasn't right in how hospitals were handling COVID?
So when I started in case management was in the late 2019, and I was hearing, little like news or deep dive, certain influencers were talking about, oh, there's this virus being cooked or whatever, and no one was taking it seriously. I've just broken into case management, where I am now having access to so much more information, having a caseload that's so much higher. You see a lot more what's going on with people, not just in the hospital, but on the outside. And you're also looking at what's bringing them into the hospital, because a huge thing we do is red flag readmissions. That's when I got to, look at how nurses was operating. That's when I realized, even before the COVID protocols, the younger nurses were just really into protocols, which is generalization of symptoms, and they had standard orders in these protocols. It would be started in triage, and then they come up until they're admitted, and then it will be more custom, the orders according to what they're discovering via labs, symptoms, whatever. But I noticed that back in the day, we were taught to look at the patient, to use nursing judgment to make decisions, question the doctors, question orders. That's what I was taught. I remember getting in trouble in clinicals for not explaining to patients before I give them the medication, what this medication is for, what are the potential side effects, and if they have those side effects, they need to report it. I would be dinged and lose points in clinicals for not doing that correctly. My nursing school was old school. It's like almost 100 years old. So they're very old school there, and back then you spend more time with the patients than you spend on the computer charting. Now most of the nurses, I noticed even back then, around that time, COVID, because now I'm looking at things in a whole different lens when you're away from the bedside, because many times we're all like, wanting to relate to each other and not really seeing the wrong we're doing because we're just trying to get through the shift. That's how I was as a bedside nurse. I didn't understand a whole lot of things. I would say, oh, how come the patient can't have this? Things like that. I didn't understand the process of a lot of things. Being in case management helped me to understand not just the process of how things are done, but the cost. That's the huge thing, because that's ultimately what runs everything, the cost, from hospitals to insurance. It's all about the cost.
Right. So, and in the past, like, you would treat, my husband talks about this a lot as a nurse, in that they would treat the whole patient, mind, body, and soul. Right. They would teach the patient, if somebody was a diabetic, they would teach them how to not come back, like how to care for their diabetes or how to care for whatever condition they had, instead of just slamming the protocol and good old fashioned, like you were talking about, informed consent.
Yes.
I don't know what happened to informed consent, but it is not implemented anymore. In fact, it's the opposite. They lie about they either hide the effects or lie about it and manipulate a patient to take whatever is profitable. And during COVID, COVID became very profitable with the Cures Act and the CARES Act and all of the money and the incentives, the CMS incentives that came into the hospital for certain protocols. And so, and the media played a big role in hyping up what was happening. So there's a filmmaker, Jason Jones, who actually went out and filmed some of these tents and these sites being empty as the media was hyping up that they were so full. And he even called one of them from right outside, and he said, what is the wait time to get a COVID test? And they were like, oh, it's about an hour because we are very full. And he said, that's funny. I'm sitting outside the location and there are 0 cars in the line. And they hung up on him.
So that's true. What was crazy is that, so I was at a hospital here in Fresno, and I was, my assignment was the ICUs. And the first, like from February into like about April, we were really empty. I was being sent home a lot. The other case managers were being sent home a lot because we didn't have enough patients. It's called the census was so low that they were asking people to go home early, or just be on the list to be called off. And this was going on. So I mean, that is what was going on. But I am looking at the news at that same time, and they're talking about the crisis and the wait time. and lobby, and people are just having, medical emergencies in the lobby. And I am like, that's not what's happening, at least here where I'm at. It's not true. So the hospital was not making money. And I'm gonna later on, I will tell you how they try to make up for that. But it was a blatant lie, at least in my location. I think they were looking at maybe one or two locations and saying this is what's going on nationwide. But that's not true. It's according to the location. It could have a lot more people coming in or a lot less.
Yeah, exactly. I saw the same thing in Texas here, where when I would speak to people who like nurse friends and people who worked at the hospitals, they weren't doing they weren't doing a lot of the surgeries, and they emptied out the hospitals, and then they ended up laying off a lot of nurses and doctors and things because they didn't have that the business, right? And so they
Only
weren't making money.
only emergency surgeries were happening, but all elective surgeries were stopped.
Yeah, we're stopped. Yeah,
Mhm.
exactly. And so then there weren't enough patients, and there weren't enough. In fact, I worked in insurance at the time. The insurance companies were paying doctors, clinics, and hospitals a certain monthly fee so that they wouldn't just they were getting it from the government, paying it to the hospitals just to kind of keep some of that money flowing. It was a very bizarre deal. So you saw the same thing in terms of, not, I mean, the hospitals were really emptied out, and people were getting, um, laid off and stuff. So did you see anything in terms of, so they put in, there was a lot of hype around different protocols. Hydroxychloroquine was demonized. Hydroxychloroquine was used to really stop SARS-1 back in like 2000, was it 2003 or 2004, when SARS-1 happened and it hit overseas. They used hydroxychloroquine, and it just like it stopped it in its tracks.
For the
So,
invented a Nobel Peace Prize for,
yeah, ivermectin did. Yeah,
ivermectin. Sorry,
yeah,
but
ivermectin
ivermectin
did.
was being demonized too at the same
Yeah,
time.
and so was budesonide, which has antiviral properties and is so safe they give it to preemies. Z-Paks, anything that worked was demonized. But I do know, there early on they used hydroxychloroquine with the remdesivir to
Mhm.
try to give the appearance that remdesivir was working. What did you see in terms of like that shift of how the protocols were introduced in the hospitals, and how the COVID protocol evolved and became, like a really even invaded the billing mechanism, and how did that affect the patients?
So I once the protocols were rolled in, I think it must have been like April, May of 2020. They started to have this COVID protocols, but then every single respiratory sign and symptom was being put or processed from triage under COVID-19. Everyone was suddenly, if you have a common cold, if you have asthma, you were put under the COVID-19 protocol, initiated in triage. And I remember the hospital, the triage was out in a tent outside the hospital. So like about a few weeks before that, they were saying that this is just a conspiracy theory. This is not real. I remember one of the managers of the med-surg unit was telling me, she's like, you know what, they're saying you got to put on mask. It's just BS, let's just do it. But then when the county, because it was all county based, some counties were really coming down hard and pushing it onto the hospitals. Other counties were not. It was all county
Yeah.
based. Because remember, Trump said he's going to put it towards the state and then they can do it the mandate accordingly. So at that time, I was just in this one hospital here in Fresno, and they weren't taking it seriously. And then once the mandates were put in place with the Fresno, like the city council was really into being like full on mandate, Gestapo style.
Yeah.
That's when it suddenly became serious, and we were handed the little brown paper bags with a mask, and then we started just processing everyone as if they had COVID-19. And at that time, at the start of it, which was mid 2020, the PCR test, it took 14 days to give you the result if you're positive or negative. So that's when, once the PCR test came out and it was 14 days to get the result, that's when suddenly the hospitals became impacted, because isolation for 14 days until you know whether or not you have or not, because all respiratory were treated as potential COVID-19 infection.
So everything that was respiratory, you guys are breaking up a little bit, so I'm just going to reiterate what you said. So so all respiratory illnesses were just treated as COVID-19, whether there was a positive test or not, because it took so long to get that test back. And I know, like, recently, actually it wasn't, not even so recently, I think it was about a year ago, it had come out that a lot of hospitals couldn't even produce a test when they were asked to for actuarial reasons and billing reasons. They couldn't even produce the fact that a test was taken in over 60% of patients. They just made the assumption and didn't even do the test.
They would just put under the protocol and then follow the protocol. So the two things that made you go under the protocol was complaints of shortness of breath and the oxygen saturation of 88% and below. And that got you onto the COVID protocol and everything that came with it, because the COVID protocol kept changing as time went by. Like, before the vaccine, they just had, they started off with events. Suddenly it's like everybody needs to go on an event.
Which never made sense, yeah.
And so if you have CHF and your lungs is full of fluid, which is the cause of the shortness of breath, you go on a vent and shove air in until, your lungs collapse. For the COPD person, they usually run normally at 93%. They don't have oxygen, they're fine. But they were putting them on the vent too. And those were the first sets of people I saw, because I was in charge of the ICU as a case manager. Those were the first set of people dying within 24 to 48 hours under the vent. That's what I was starting to see.
Yeah, that was interesting, because when that happened everywhere. And I remember my husband would say, if somebody's got COPD, high oxygen can actually kill them.
Yes, it will. So imagine a balloon that cannot stretch because their lungs, it's got a tar. A lot of the COPD, they don't want to say emphysema, but that's what most COPD are. It's emphysema. It's like a bad word to say, but it's just a fact. And it's the tar that's on the lungs. And tar, if you put tar on something, it can't stretch, right? So it's like a balloon. You put some tar or some clay on top of the balloon. That area of the balloon that has that on it, it cannot inflate when you inhale. It cannot. So you have reduced oxygen, and then you have trapped carbon dioxide in your lungs. And so if you force air in, what's going to happen? It's going to collapse.
Right, exactly. And too much oxygen, I learned this with my own, is you get to a point where there's not that balance, and you can't breathe out the carbon dioxide, right? So
carbon dioxide poisoning. And then we had a lot of hypercapnia from the mask too, on top of that. So they had these patients who had, under the COVID protocol, they need to put the mask on. So they're breathing in their carbon dioxide, and then they're shoving air in, but then they cannot release the carbon dioxide because their mouth is covered up. So it was just not a good situation happening. And
It
No one.
made no it made no sense. The protocols and the medicine and everything made no sense, and it wasn't based on what you could see was working. And so you saw these patients dying.
There was no
Um,
sense in what they were doing.
do you think at the time, like I'm going to just take it like 2020, and then before the before the shots, right? Before the shots. Do you think nurses that were treating these patients, nurses and doctors, were actually kind of confused about the treatments at first, or do you think did you hear them, or did you hear people speaking out like, "Hey, this isn't working"? Like we had whistleblower nurses that went public and were like, "Patients are dying. Remdesivir is killing them. This is what's happening." Sound the alarm, sound the alarm, right? You saw that in the summer of 2020. What did you see where you were working? Was anybody sounding the alarm then?
So I was seeing, and this is like generational types of nurses. Like
Yeah,
the older ones were like, okay, at first this is not making sense because we come from an era of like, okay, we're governed by common sense, nursing judgment. We didn't start off with these protocols. It
yeah,
was a thing, and so we think critically. We can still think critically. The younger nurses who were like starting off with the protocols, because back in like say 2000 and 9, 10, that's when ER started having these protocols
yeah.
because they were having so much sentinel events happening in the lobby that they created these standard protocols that the triage nurse will
Sure.
initiate until the doctor can get to see the patient.
Yeah.
So that era of nurses, the younger ones who were all into protocols, I think they were kind of panicking. They didn't know what's going on, but they're like fresh out of school. They got their little loans to pay. Uh,
Mhm.
they're finally earning money. They didn't want to rock the boat, although they were sensing that maybe something is not adding up here, because just to get through nursing school, you got to have some smarts. So I know they know something was not adding up, but they had a lot of reasons, like a lot of doctors. It's like, okay, we got bills to pay. I want to keep my job. I know it doesn't seem kosher. And then there was older nurses like me, like case managers. A lot of them are typically older. They have health conditions. They need benefits, and they were talking and saying, "This is not making. We're seeing things here. This is BS. This is not right. This is unethical." But we were talking among ourselves with it. Many of them were talking among themselves, the older ones, because we have more access to things, more information as case managers. So we're seeing more things, we're seeing more patterns here, but they weren't seeing anything because they realized that the moment you speak up, you'll be shut down, because they were seeing it happening already. Um, and they didn't want to say anything. And some of them were just outright scared because they were
Mhm.
seeing, like for me being in the ICU, the other nurses, the other case managers in the ICU, and typically the ICU nurses and ER nurses, they know the correct reason for events, because that was the number
Sure.
one treatment before the vaccine rollout to treat COVID, the ventilator. And they were saying, for me, having the background in trauma, a lot of younger people, or older people, doesn't matter. When there's trauma there, and there's like maybe a hole, puncture, whatever, pneumothorax, whatever, um, you're put on the ventilator because the lung muscles are not working to expand and contract. So you need like a machine to do it for you. But all these COPD patients, all these asthma patients, all these congestive heart failure patients, it's not because their lungs are not working. So it was an absolute misuse of the ventilator on these patients, and they're the ones who were being killed. And let me add another thing that I remember sitting down one day with the early before one of our huddle with the case managers, and they were saying, oh, all these patients who are readmissions, meaning the COPD and the CHF patients, COPD, CHF, they tend to come in 2-3 times a month. It's called a readmission. And a readmission is something that's a huge focus for us case managers, where if someone comes in more than once within a 30-day period, the insurance will not pay the hospital for that visit. I think you're familiar with that.
Mm-hmm.
And so we're being told to put these people who were CHF and COPD exacerbation, to put them under the COVID protocol because they were meeting, and then the hospital will get paid. That's what I was being told to do.
Right.
That. Okay. And so under the COVID-19 protocol for the DRG, that code you assign, they came up with one for COVID-19. This is how billing was affected. They came up with the coding, the ICD-9 code for COVID-19. We're able to put it in the interqual, which is what we use to, assess criteria for admission. And so now we had this new reason, instead of putting these people under the CHF exacerbation or COPD exacerbation, which it was.
Right. Exactly.
I was told, you know what, the hospital needs to get paid. We've already lost money from the last few months of low census. I am quoting you what was being told to me. Because we had low census and we lost money, put them under the COVID-19 protocol for admission, and we will get paid.
Yes.
And that's how the hospital got paid, because these were the people who were coming in 2-3 times a month, and the hospital was eating the cost. This is why I do utilization management, because it's all about the cost. And so we were putting them under that protocol, and then they would be put on the vent like within 24 hours. And then by the next day or the following day, they're dead. But the COVID protocol, DRG, that I would assign for their admission, the hospital, the length of stay was 14 days. So it was the flat rate package of 14 days. So these patients were being killed. I'm gonna say bluntly, they were being killed within 24 to 48 hours. So that's 2 days. So that means for 12 days, if they die, 12 days, the hospital has already gotten paid for. And then if they die in the vent, there was what, 30 something to 40 something $1,000 if you die in the vent. So then,
and if you took remdesivir, there was more.
But this was for remdesivir and the COVID jabs. I'm still talking about 2020. This is what was going on. And then the ICU doctors were being coerced into putting on the death certificate. They died of COVID. What they really died from is COVID protocol, because the PCR test was still pending. It took 14 days for the PCR test to give a result, and they were being killed by the ventilator within 24 to 48 hours, and the hospital was banking the 12 days flat pay in advance, because once I okay that and it meets criteria, that goes to the insurance company and the hospital gets paid.
That's criminal.
Yes, that's we were talking among ourselves, and
it happened everywhere. I mean, we
were seeing what was going on.
And there's still things that,
and saying, "Oh, they're getting rid of the patients. That's costing the hospital money."
Yeah, that's exactly what
that was the twisted joke where we were laughing and scared at the same time, realizing that this is playing out before our eyes.
Oh my!
My pores are goosebumps, because it was one of those moments where you saw the horror on their faces when they realized this is what's going on. This is what they're making us do.
Someone needs to send this to Trump.
So this is why that hospital got investigated by the FBI, and they almost got shut down.
Let's get into that.
I want to play a clip. Just the short clip that I have of your interview with on the Children's Health Defense bus, which we all interviewed on. Those interviews are great. If people haven't seen them, they need to see them. But I just want to play this short clip of you, and then I want to get into what made you stand up, how the FBI investigation came about, and everything that came. I want to spend the second half talking about that because that's incredible. So let me just play this short clip.
My name is Nurse Rena. I've been in the nursing field for 20 years. I started off in my specialty is case management and utilization management. And so we work behind the scenes in the hospital. So I was in one of the local hospitals here in Fresno, working there when I saw the start of the pandemic. And then the tail end of it, I would case manage typically the ICUs and the inpatient floors in the hospitals. In February, March of 2020, I remember the unit managers, the directors, they were saying, oh my God, this fake disease is coming off. It's just like the flu, just ignore it. It's just, it's not real. And then it started getting out in the news like around April, May, and that's when no one was coming to the hospitals, even though the televisions were saying the hospitals are bursting at the seams. It was quite the opposite. It was empty. No one was having elective surgeries. Everyone was scared to come to the ER. I was being sent home a lot because we did not have enough census, which is the term we use for the amount of patients in the hospital. We were being sent home a lot, staff. It was quite the opposite what they were saying.
Until
they came out with what the COVID mandates to impose. And once that started being imposed, that's when everyone was like, trying to line up. Suddenly they were saying, they went from, this is nothing and this is fake, it's just a flu, to like, okay, we got to do this.
So there came a point when you couldn't stay silent anymore. And so walk us through what that process looked like. You must have known there was probably going to be a high price to pay, but you did it anyways. You spoke out anyways. So I'm always interested a little bit in, because moral courage is in such short supply in this nation right now. What brought you to the point of, hey, I need to speak out? And then number two, the second part of that is, you had to weigh I'm sure you couldn't imagine exactly all of the things that you suffered, but you knew, wow, this is going to be tough. So what was it that made you say, I have to speak out? And then what helped you overcome any fears you had about the impact of speaking out?
So when I really spoke out was when the hospital set me up to let me go, and I started speaking out on Facebook and to certain people I know in certain positions privately. So when I did, so let me tell you what happened. I was starting to teach patients about their rights and about things that they can allow to happen to them, and what, you do not need to follow this. You do not need to just, nod your head and let everything be done to you. I started informing them, and word was getting around that I am educating patients, and it's against the protocols
to educate patients.
Informed consent.
Yes. So that they didn't like that happening because I do discharge planning, and I was, if a nurse, wants, like if they need to go home or even do treatments in the hospital, the nurse were kind of trying their best. Some nurses were trying, others were just doing what has to be done. And I would go back up those nurses who say, Rena, can you just come talk to them? Just back me up and let them know about this, because you're the case manager. And I'm like, okay, I will go do this. I would do things like sneak visitors in, like sometimes I would cover the cancer floor for this one case manager on her 2 days off. I'll go cover her floor. And so a lot of them who were dying of cancer were dying alone because no visitors were allowed if they didn't have the vaccine. Utter and complete shame. It's one of the most disgusting things ever done to a dying cancer patient was to tell them die alone. And then they had one tablet for the whole floor so that they can talk to a family member, so that they can talk to someone before they die alone. It was disgusting. So I was doing things like sneaking visitors into the room as a case manager so that they can hold their hand and die not alone. And then they were having a problem with me doing that management. They were saying that's against hospital policy. You shouldn't be doing that. So then they started paying attention to me on the things I was doing. And the other big thing that really caused them to try to set me up to let me go, and this was before the COVID vaccine became a mandate, which was in early to mid 2021. They had at that time they had started allowing elective surgeries to happen again because they had sped up the process of the PCR from first 14 days to 3 days and then now 45 minutes.
Yeah.
And so they were allowing elective surgeries to happen. And so what they were doing was telling case management team to save money, those who have to go back to the nursing home and have a discharge order, do the 3-day test on them, because the SNF is requiring, SNF is a skilled nursing facility for those who don't know. The SNF is requiring, but be it going there for rehab or if they live there, they have to have the COVID test done. This is a requirement so they know where to place the patient in the nursing home, in an isolation room or with maybe 4 to 8 people, because that's a reality. Where you have someone who has their own room in a nursing home. And then we have about 5 rooms, 5 private rooms. And so they need to know if they have a room available, because they had this, they had to go stay there 7 days, whatever, and then they can go back to the assigned room, which is the shared rooms. So they were telling the nurse case managers to do the 3-day test and lie or kind of like twist words and tell the SNF that, oh, we did the COVID test. And they'll be like, well, what's their last COVID result? And so they know very well the result is pending. So they're going to go back to the last time they had a negative or whatever and use that result and tell them. So it was a little word play going on, if you know what I mean. And so that's not being transparent. That's not being honest. So I was holding patients for 2 additional days, because as a case manager, you can do that. Even if they have a discharge order, we can hold the patient for additional days until there's a safe discharge, because now we've taken over the care from the doctor. We're in charge really of the patient to keep them or send them out, because we're working on things for them outpatient. So I would literally keep them there, and I will, it's for pending COVID results so that they can go back to their home. So I'll put it under administrative, reasons. You get less pay for that. Okay, administrative, if it's for that reason. They want full pay or get them out. That's basically how it was.
Right.
You know how they think.
Yeah,
so
exactly.
Then they found out that I was doing that, because when we're doing the extended length of stay, meetings, we do that as case managers. They're like, how come this person is still here? And they have a discharge order, and they have an accepting bed at the facility, or they're a resident there. And so they called me out on it in the huddle and chewed me out in front of everyone and said, why am I holding the patients? I supposed to do, because then I started doing the 45-minute test, because they're saying we need that bed. So then I started, I had the ability to write the order for the 45-minute test. Back then, we were able, case managers, we can write orders. If you don't have an order for something, we can write an order. And so I was writing the orders for the 45-minute test, so that, okay, if they have to go, we know that they're negative and they will not expose the others to, this virus. So then they chewed me out. because I was not only holding patients, I started ordering the 45-minute test for those, because sometimes they said if it's someone going for rehab, they will lose that bed. So I'm like, okay, now I need to get them out today. Let me do the 45-minute test. And
was that normal for them to call out somebody in
front of
public
everyone?
like that?
No, it's not.
Yeah,
it's embarrassed me.
Or no, was it common? Was it common?
No, you're supposed to pull someone.
Yeah,
them, not in front of everyone.
They did that on purpose.
Under normal circumstances, you wouldn't see that in a facility. You wouldn't see that anywhere, much less in a hospital. But by this time, what year was this that you?
2020.
So
no one in June 2020.
Right. So no one else would speak out either, huh?
Yeah, because they literally do a dress down. It's like, how dare you cause the hospital by doing the right decent thing.
Wow. And then nobody else is gonna ever.
And so by being publicly humiliated in front of the whole department, it was like, anybody else try to do this, okay, we're gonna not pull your head and talk to you. We're gonna talk you down in front of everyone and embarrass you in front of your colleagues and peers, which is what they did to me.
Wow.
And then the very next day, that's where they set up the little thing to get me out of the hospital, where I was talking about, and I spoke about the same incident in my Nurse Whistleblower video, where they saw me talking in the nurse's station in the corner by the wall, away from all patients, with my mask half off. And they asked me, they had the charge nurse come up to me and tell me that I need to pack up my stuff and leave the unit and leave the hospital and come back with a note, a doctor's note that said I can ease my mask halfway off my face to talk to someone. I was talking to a patient's relative who was hard of hearing. And so with the mask on, it was muffled and she couldn't hear. So I had to take it off for her to hear clearly. And they literally said that I need to have a doctor's note that says specifically that I can ease my mask off my face to talk on the telephone and don't come back to work until I get that. And that was how they pushed me out of my job, because that very day, employee health was suddenly closed. And then the next week, I got a backdated insurance letter from the hospital changing my PPO to HMO, and it was suddenly Indian Health. I'm like East Indian, but I'm not American Indian. So it was changed to an HMO, where that's the only place I can go to as a PCP. And then when I called them, this was in June, they said the earliest they can give me was an October appointment later on the year. Because of my race, I'm not American Indian. So American Indians will get a sooner appointment. For me, I need to wait 4 months for an appointment in order to get a doctor's note to go back to work. So I can ease the mask off my face to talk to any hearing impaired patient or family member.
And that wasn't even about safety. That was about control and power.
Have you ever heard anything so ridiculous in your life?
That's crazy. That wasn't about safety. Not at all.
And so they waited for, I tried every day trying to get appointments. They said I need to show evidence that I'm calling and send in my supervisor text. And so I did that for 2 months. And then they ended up sending me this letter. They never replied. They never responded back. And then HR sent me this letter and said, I am inactive. And so they're letting me go because I have not worked for 2 months.
And she was on the phone. Just pull down the mask halfway.
Oh, we're not.
We can't hear you, gal.
Oh, that's because I muted because my dog was about to bark. Yeah, so that it's ridiculous and it makes no sense. And it clearly was they were clearly targeting you. So how did so who did you blow the whistle to first, and how did the FBI get involved?
So I can't name the person who I spoke too. Once I was in this limbo for 2 months, I was just talking on Facebook and talking to people
Mhm.
about this. And so this person is, it's a military person,
Yeah.
and he had connections in the FBI. And
Yeah.
so it was not like something I wrote on paper and submitted as a whistleblower. I told him the story. He passed it on, everything I told him, into the department. And then that's when they went to, investigate this hospital. And then I only found out because it's been hushed up. I did not know they were being investigated. In the meantime, I had gotten a job with another hospital in another county over. And it was when the doctors group came to that hospital, the head of the doctors group pulled me aside and said, "Hey, Rena, guess what? All the things we were complaining about and talking about, the FBI is investigating the hospital and they're trying to shut it down." And that's how I found out about it. And then within 3 weeks of this doctor telling me about this, that hospital, this other hospital now, set me up to fire me over a TB test. And it was a similar playbook. They sent me this email that my TB test was due, the annual one. And when I showed up to work, it was a Wednesday, and it's a 3-day thing to read. So that meant I had to get it on the Wednesday and have it read on the Friday, because then I had to submit my annual by Monday completed. So when I went on Wednesday, guess what? Employee health was closed. No notification, nothing. They were just closed. So the director of the ER, I was the case manager for the ER. The director of the ER said, "Hey, Rena, you need to go get this done. It's important. There's a clinic for the hospital, which is owned by the hospital, just like at the end of the street. Go ahead. If there's anything, I'll look out for it for you." So she sent me to the clinic. I got it done. I went back. I got it read. And then they called me Friday evening, I believe. And like during the weekend, they called me, the case management director, HR. They called me and then they said, "You know what? You did not follow directions. We said you need to go get the TB test at employee health. You did not go to employee health. That meant you did not follow directions, and you abandoned your post because you went outside the hospital and got it done. And you did not tell anyone," even though I was sent by the ER director. And they chose that. And they said, "I need to show up Monday to HR and not to my post and turn in my badge, because they're firing me for not following directions and abandoning my post." And this was 3 weeks after the doctors. So I'm sure the doctors went and told this other hospital, "Hey, she's here."
Wow.
Yeah. And,
Right.
and that's when I realized that I can't work in any hospitals locally. They're passing the word around and doxing me.
Wow.
Yeah, they blacklisted you, right? So now that is very common in the medical field. They'll blacklist somebody who's not for doing the wrong thing. I mean, kill a patient, they won't blacklist you, but stand up.
I think it's a joke. Everyone posts about there's no retaliation for speaking up. And
Oh yeah, right.
that's one of the biggest jokes in healthcare.
Whistleblower protection is a myth.
We don't retaliate. That is one of the most outrageous lie perpetuated by the healthcare industrial complex.
And they tell it every year. Whistleblower, you're protected as a whistleblower. They want, if you see something, say something. I
advocated for my patients. I advocated for those who were killed.
Yeah.
That's what got me.
As a matter of fact, you have to do a training every year, ethics training. Yes. A lot of people do in many fields. And
it's corporate training.
Right. It's all part of the training. And you have to sign something saying that if you see these things that you actually spoke out about, that you will report them. Mm-hmm. And it takes you through the escalation process and how you're supposed to report them. And if you didn't report them, you would be you would be liable for not reporting it. And
Yeah.
then and they're very strong about saying, and whistleblowers have this protection. I would like to see the protection be actually tested in terms of a lawsuit with
paperwork. It's all for show on paper, but not actuality.
I
That's
know.
what I discovered.
What she's lived through, from all this retaliation is just absolutely criminal.
Yeah.
So I want to talk. So the FBI got involved, and there's a lot of circumstances. I mean, there was a price to you standing up, and I want you to kind of go into that, because there was a price. You're blacklisted. There's attacks. There's all these things. Go into the impact that this has had on your life, right? Being a whistleblower. And but I also want you to speak to nurses and doctors who know something's wrong, because it's still going on. Patients are still being killed. Nurses and doctors who know something is wrong and are staying silent for fear of retaliation. So both of those things. What was the impact to your life, and what would you say to nurses and medical professionals who are too afraid to come forward?
So first of all, the impact it had on my personal life has been it's been very hard on me, because I have been a single mom. I have at that time, my son, he was in elementary school. He lives with his dad and stepmom, and and my daughter lived in a different county was in Madera County. And they made sure that I could not get another job for months at a time. I could not get unemployment, any type of benefits to help me with zero income coming in.
Mm-hmm.
They did that to me. That hospital had me in limbo for 2 months. I could not get unemployment, nothing, because I'm still employed with them. It was sick, because it means you go through your savings. And once your savings is done, what are you going to do if you can't get any benefits and you can't get a job? You have to leave town. I've had to leave my kids behind, be away from my kids, not see my kids for weeks at a time during that time when they started blacklisting me. I had to work an hour and a half away. That hospital I'd gotten to, that they set me up to fire me, it was an hour and a half away from home, because I couldn't get any job here in Fresno County. So I had to go to a different county and work. And so it cost me a lot more in gas. I cannot, but just to work like far away. And then once that happened, I realized I'm putting out applications and nothing is happening for any jobs. And I had to make a hard decision to start doing travel contracts and being whichever part of California I get, and go without seeing my kids for weeks at a time. And my kids needed me, And so that's the huge impact that it has had, because my kids had to be without me for most of their lives in the last 4 years. So that's been the hardest.
That's been the hardest. Yeah.
They've grown up without me most of the time, because the only way I can work is if I work as a travel nurse. Okay. And so my relationship has been affected, where we're not close as before the pandemic, because they've grown so used to not being with me. And that's so criminal. And then they targeted my son's dad and stepmom, where they could not get work for the last 2 years. they actually had to move out to the state last year and take my son and have the address hidden because they couldn't get jobs, and then they couldn't get the same benefits. Same thing that was happening to me started happening to them because they live here in Fresno, and I was coming back to Fresno because my son is here. Otherwise, I would have gone to a different county or whatever. But my son being here was bringing me back to Fresno to keep talking, because by the time until last year, I've done the nurse video. I've connected with Heidi. I protested in front of the hospitals. They did not want me in town, and so they targeted not only me but my kids and their dad and stepmom, where they have had to live in financial distress too, so that they would give up and leave. And so my son had to move to Oregon last year because the dad's grandma lives there and could help them because they somehow just cannot get a job. The stepmom has a master's degree. The dad has 2 computer degrees, and they cannot get a job to save their life. So this is how demonic these people can get to make you pay for speaking up. They do things like that. And then my daughter, who got autism from the COVID shot that her dad took her to get, she has a full-blown autism where she can't even function. She needs supervised living. And I tried to take her in last year and get help, things set up for her. The social services department, were saying that, okay, something is wrong here because everything we're trying to set up, it's been delayed or it's not working, and this is not normal. They've never had this happen before. So then my daughter had to end up going back by her dad this year because I could not get a job. I could only get a travel contract, which was, in Sacramento. And so she was supervised living. So she ended up going by her dad. And I haven't really heard from her since because she felt guilty that, she put me in a position where I could not work. I had to be, with her to do everything with her. This is what it has cost me.
So what would you say to nurses, medical professionals? Because there's billing people, there's a lot of people that know what's going on. There's social workers that know what's going on. There's advocates, there's PT therapists, there's respiratory therapists, nurses, doctors, aides, people who know what's been going on in these hospitals. And what would you say to them about speaking out?
So I would talk among them. In every one of these jobs, I was talking to people, to doctors, nurses, whether they agreed with me or not. I spoke my mind. And I remember doctors like in ER when they had set me up to fire. This one young doctor, he was a main doctor who was the regular in the shift that I worked. And he was young, fresh out of internship and now on his own. And he would be talking about, I have my loans to pay and this and that. And, he was very woke. And I remember saying, well, these things we're seeing, shouldn't it be reported? He's like, I'm just here to do my job and just for these patients. And I'm like, okay. Because we're seeing things here. This is when the vaccine injuries were starting to happen. And it had just been rolled out, and we were just getting so many people with vaccine injuries. And I'm like, well, nobody talk about it. And even some conservative nurse, I had this one conservative nurse, she was like big, I'm like this conservative nurse, but then she was staying quiet because she's a single mom. And I'm like, well, I'm a single mom too, but I'm speaking up because it's the right thing to do. Mm-hmm. I said, do you guys not remember back in nursing school to be checked off in clinicals? We need to do informed consent. If there's injury to a patient, we need to advocate and speak up. Remember, do no harm. What about that oath? Do no harm. And a lot of harm is happening. And because it's a protocol, I was saying that protocol will not save your license in a court of law.
Right.
Because I worked in the prison system, and I understand that, what you do in the hospital, those protocols and those policies will not save you in a court of law. So I was trying to, talk sense into them and say, hey, when this blows over, and you guys stay quiet about it, you could be called into account. You can be brought into lawsuits. That's why I'm speaking up about this and trying to do things, because I know in the end, once this crisis is over, there will be accountability. So
Yeah.
I'm trying to touch them on a legal basis. I was trying to, do you have a conscience left? Are you so jaded that you don't care? You're just here for your paycheck and benefits? Some of them were just openly like that. I have bills to pay. I have a loan to pay. I'm just going to shut up and do what I have to do because, I need my paycheck. That was the attitude with a lot of them. And then the older ones who were seeing the stuff, they need their medical benefits. They can't go without their insurance, even though they feel bad. And so this was the spectrum of people who I know they should have spoke up, said things, back me up, but then I'll be like the only person there being thrown under the bus, being attacked like, all of them like a pack of hyenas. And then there's a group that's silent. The ones who are silent were condoning a lot of things, and so
Silence is compliance, right? I mean,
and then it's a lack of conscience. And I think I have noticed just overall in this country, there's like a moral decline with people. And in an area that's supposed to be humanitarian, you got to have a shred of morals. You got to have a shred of conscience, at least, to be working in it. And I do not know how they can go to bed and sleep at night, knowing that they just stay there silent and watch me be destroyed, and didn't even have the decency to stand up and say, hey, that's also true. That's also,
yeah.
we're seeing this too. It's not just her, but they just stayed silent or they condemn me. And I had just all my social media accounts I was locked out of it from talking about it. And then they were calling me outright liars.
Mean, so like,
crazy.
I get where people need, that whatever they need to make a living or whatever. But if somebody came to me and said, Gail, I'm going to need you to randomly kill 5 people a week, just pick people in order to keep your job. If my boss said that to me, I would be like, you're nuts. You're a crazy boss. What are you talking about?
That's in black and white, Gail. Because what if you witness a murder? Most people they're such coward. I think there are so much cowardly, spineless people here. They call themselves Christian or they call themselves God-fearing, but they're cowards. And cowardness actually dragged out, the whole pandemic and the silence, so that more and more people were killed under these mandates because they chose to stay silent. And so it dragged out for long.
And it's still dragging out.
Yeah. So when you stand up, it actually eases. But when you just take it like a dog lying, it continues. So then all these lives that were killed, all these lives that were taken, and all these vaccine injury people right now suffering day in, day out, that could have been prevented if they had just had the courage, the decency, the morals, the ethics to speak up and do something. But everyone's addicted to their comforts and their ease and all of their like conveniences in life.
That's what I say all the time. We are in America, we are so comfortable, so comfortable. We cannot give up our nice car or our, we can't live simply so that we don't have to be slaves to what's happened. What this has made people slaves. It has literally made people do things that they know are evil or wrong.
Yep.
In order to stay in the good graces of people who are making them do evil and wrong. And that it is cowardice. And I wish I could say it was being afraid in the face of death, but it's not. It's being afraid in the face of being called a name or
Well,
losing a Facebook friend
a lot of
or
people telling me that, oh, they did this for their kids, because then, they can take care of their kids and all that. I said, what you taught your kid is that comfort is greater than character.
you've taught your kid that, and you've also put your child in danger, because what happens when your child is the one that goes into the hospital? And we see it, right? I mean, we're dealing with a 2-year-old and a 17-year-old now in 2 different states, right? That are being, like, what happens when it's never enough? It's literally never enough. My granddaughter, when in the beginning of the pandemic, we went into a store. She wanted a specific ornament that was at this holiday store and a specific stocking. And at the door was a person, an officer, enforcing masks. And I said, oh, I have an exemption. I just kept, and my daughter said, I have an exemption. And my granddaughter said, I'm not old enough. I'm under 10, so that law doesn't apply to me. And the officer said, okay, I'll get the manager. The manager said, as soon as I said I have an exemption, she said, oh, that's not going to fly here. I said, okay, let's go. We're not going to, because I would spend thousands of dollars there every year. I said, we're not going to shop here. And when we got to the car, my granddaughter said to me, she was 8 at the time. She said, Nana, could we please just put on the mask to get that ornament? And I said, no, Naomi, if they can make you do things that don't make sense for the things that you want, imagine what they'll be able to do for the things that you need, like food and shelter. Mm-hmm. We cannot compromise ever for the things that we just desire, because that's not the end of it. And everybody laughed when we said the masks will lead to mandated shots. Mm-hmm. Oh, no, that will never happen. And that's exactly what happened. Mm-hmm. And the number of stories we see where people have had a stroke or a heart attack or died because of a shot mandate is incredible. And every single time I do one of those interviews, and I hear the words, I didn't want to lose my job. I had been there 14 years. I didn't know what to do. It makes me sad, because where I worked at the time, we fought the mandate and won. And that it took a lot. I mean, people had to stand up, but it took 21,000 people holding the line to do it. So you're right. If people stand up, you can change. If enough people stand up, you can change the world. And that's why on betrayalprojectusa.org, that's why we want these stories. We want, we don't want you to just tell your story because we want you to tell your story because it's going to make a difference, whether it's a protocol story or a story about the shots or some type of medical betrayal. It's going, and if enough people speak up, that is, it gives credibility to everybody else's stories. And so, and if there are other whistleblowers out there or people who want to be whistleblower, contact us at email at betrayalprojectusa.org, betrayalprojectusa.org, or you go to our website, betrayalprojectusa.org, and click contact us. And we'll have you on the podcast to talk about what you know. There's going to come a time when nurses and doctors are going to come forward, or medical personnel, wherever they are in wherever they work in the facility, where they're going to come forward, but it's not going to be whistleblowing. It's just going to be jumping on the bandwagon because everybody else has already paid the price.
About that, because right now what I'm seeing, all these, like on X, like because now it's safe to talk about it.
Yeah.
You see all these grifters grifting on it, and hungry and desperate for followers, and they act like, I'm like, what have you done?
Mm-hmm.
All you do is talking big and putting on a little emotional show about things that you're seeing or things that you did see. I said, back then when you're seeing it, why didn't you say something? Why is it now?
Exactly.
Because there are a lot of grifters on right now doing that, and they're blowing up on X, and they sound like they're an authority and expert. I'm like, where the hell were you years ago when this was
2020? Yeah, exactly.
Exactly. Where
Yeah.
were you when Gail was
yeah
almost being murdered in the hospital?
Quite
My best friend,
paycheck.
when my best friend was literally being murdered in Clovis Community Hospital, and the chaplain came out and told Bob Bosley, because his wife was being murdered at the same time, hey, they're murdering people in there. How come she didn't speak out? How come she didn't call 911? How come?
Yeah, could you imagine if everybody who knows what's because how many times me and Heidi hear this a lot from victims, where a nurse said, it's a bioweapon, or the nurse said it's they're killing people. We're emergency room. Now I do understand, and some there are nurses that we've spoken to who sneak in the right protocol. They're saving lives. There are doctors in emergency rooms that are putting not a candidate for remdesivir, or telling people to go home, giving them a doctor to go get ivermectin from, or hydroxychloroquine. They're staying in those positions and doing those things on the sly because they're saving lives.
Yeah.
That does make a difference.
But there's a small percentage, Gail.
Very small, very small. There's about 1 million doctors, and I think there's somewhere about 1 million doctors in America, and I think there's somewhere it's well under 2,000 doctors that gave the right protocol.
Yeah.
That is not high at all.
Yeah.
Not at all.
Yeah. And my friend's cousin, Vince people at Clovis Community Hospital, where my best friend Lupe Espinosa was murdered, she said when they were using hydroxychloroquine, 14 people survived the event. After the hydroxychloroquine was banned and remdesivir was mandated, everybody started dying in mass. And I said, you need to speak out. And she said, I can't lose my paycheck.
Can't lose my paycheck. But people are losing their lives, and that includes children.
But
it includes children.
What they were doing, they were to get a paycheck, they were allowing people to lose their lives. That was their rationale.
Exactly. And tell us, walk us through, because you were there, you saw what was happening. How were these protocols ending people's lives?
So first, before the COVID vaccines rolled out, it was the ventilators that was ending their lives. And then we had the COVID vaccine starting to roll out, and immediately the ER, I was in the ER at that time, I was having about a dozen per shift coming in with, their arms, cerebral palsy type of symptoms, where it's rolling up to their neck and to their face, and it's all numb or starting to droop. This was the number one thing I was starting to see within a month of the vaccines. These were the type of injuries. And then because you remember, it takes time for the clot formation to start happening. So I saw in about 3 months' time after the vaccines rolled out, which would have been, it was mid 2021. By the ending of 2021 was when we just suddenly saw the surge in myocardial infarctions, which is a heart attacks, CVAs, hemorrhagic and occlusive. PE was, oh my God, we're getting about half a dozen a night. PE, which is a pulmonary embolism in the lungs, a clot in the lungs. But here's the number one thing I saw in the vaccinated people, as someone who had access to every single person in the hospital. I had access to their labs, because their labs, I had to review their vaccination status. I had to review along with everything else. all of those who had the COVID shot and had COVID had really high blood sugar
Yeah.
and a really high fibrinogen. So fiber to clot.
Yeah.
So think about sugar, how it works in the blood. When it's high, think about a drink that's really sweet, like syrup. When it's high, how does that flow? Really slow, right? And then you have this fibrinogen, fibers to help create the clot. And then if you have spike proteins from the jab, all that combination is creating clots. I started putting it together when I saw consistently 99.9% had the high blood sugar in the hundreds and the high fibrinogen, really critical ranges, every one of them. And so that was starting to explain why the clots are forming in all different parts of the body. DVT is revved up. So everywhere you can have a clot because clots are in everywhere. Okay, and the higher blood sugar is so even if the clot is occluding like a vein and all this is the clot, so the pressure is building up. That's how a lot of people suddenly start to get the hemorrhagic strokes. Because when it's occluded, the pressure builds up, right? And then it explodes. So that's how you're getting all these strokes. You're seeing in young people in their 20s and 30s. The heart attacks was just revved up because if they had high cholesterol prior, high blood sugar, this just sped up the process. That's how a lot of them, they were not surviving it because just with the comorbidities alone, they were dying.
Yeah.
Muscular problems. So.
Yeah, exactly. So, yeah, them, and it's and people are still getting. I used to kind of joke and say I think my mom is the only one getting the boosters, but it's far beyond that. I'm seeing it, and people are getting sick and dying from. Oh my gosh! It's in mass. So you have remdesivir and other medications that they're giving that are killing people, still killing people in the hospital, but killed them. I mean, 95% of the people who died in the hospital, and they got the protocols. And then you've got this whole other thing. It was all to convince people to take the shot, which is also killing and maiming people. And we speak to a lot of vax injured. I think Robert Kennedy Jr. is definitely on the way of doing something about the shots. And I do believe he's going to do something about remdesivir.
RFK is a godsend.
Yeah, I think we got to give him the time to work because he's in a den of vipers, right?
So my next thing would be, we talked about the ventilator, we talked about the shots. Now I can talk about how remdesivir, once it was added onto the hospital protocols, back in 2022 was when that was passed onto all the hospitals to.
Well, actually, they were doing it in 2020 because our earliest remdesivir case is February of 2020. Believe it or not.
Are you serious? Yeah. So I wasn't. I didn't see that then, but I started seeing it because remember I had gaps in employment. And so in 2022 was when I saw, I was at these two hospitals in Bakersfield. And that was when I saw the damage that was being done
from remdesivir.
And that's when I started to see the crazy amount of moms dying in childbirth and kids dying during delivery, like about half dozen a week to a dozen a week. We're having moms dying in childbirth, they're hemorrhaging to death. So what remdesivir does too is so these moms, what I know is for antepartum care. Back then, to enter any doctor's office, you had to have the COVID shot to enter any doctor's office on the outside. They were being pushed to be vaccinated. And then if they did have COVID while being pregnant, they were given remdesivir. Even if you're pregnant, they were giving them the remdesivir. What
Yep.
does remdesivir do? You go into heart and liver failure. That's what I was seeing happening,
And
because
yeah,
I was doing the of course, again. When they come from the ER, they start the protocol in the ER, and the remdesivir is given in the ER. So then, if they were stable, they got sent up. They would get admitted to the med surg floor, which is not high acuity, just regular acuity. And so I am doing the authorization to med surg. So then that's one day. The next day I come to work, I'm like, what the hell? They're in the ICU now.
yeah.
Oh, they're in septic shock and kidney failure. And then I started getting about almost a dozen of these per shift. And so the ICUs became impacted, because suddenly we have so much of them in kidney and liver failure, because they were starting to give the remdesivir to dialysis patients. Oh my Lord Jesus. Their kidneys are not working to metabolize this super strong medication. Okay, but they're giving it to them.
Yeah, it destroys the kidneys, the liver, the
Insane.
heart.
I was seeing so much deaths happening with dialysis patients, or those with end-stage renal disease or chronic kidney disease. They were the ones who were starting to die a lot once remdesivir rolled out, because their kidneys cannot handle it.
So let me ask you, because you said this was in 2022. So we know in 2020 they were using hydroxychloroquine with the remdesivir, because hydroxychloroquine negates the damage, some of the damage from remdesivir. And so they built up this confidence in remdesivir that was false. It was really the hydroxychloroquine. And that's how they got the FDA approval for remdesivir, right? It went from being an emergency use authorization drug in early 2020 to actually an approved drug,
Yeah.
which was a different formula, but that's beside the point, which it became a approved. We know the majority of the deaths, well, a huge amount of the deaths from remdesivir took place in 2021. And then Biden declared the winter of the unvaccinated, the pandemic of the unvaccinated, which is when we saw Heidi's friend Lupe die. I was almost killed. We have tons of that. Is the most cases we saw shoot up was between August of 2021, when he declared that, and they were trying to put the mandate in for the shot.
That's when I saw the crazy off the charts death happening.
Yes, right. And so from August of 2021 until March of 2022, there was this mass carnage. It truly was the winter of death. They took control of the Regeneron, the antibodies, right?
Monoclonal, the monoclonal
antibodies, particularly the Regeneron. They pulled it from states that were using it quite effectively, and you couldn't get it. And then they made it hard to get ivermectin and hydroxychloroquine, and you had to go to a compounding pharmacy, and if you could find one to do it. And so a lot of people ended up in the hospital because it was go home, do nothing. We have on betrayalprojectusa.org, we have a hospital deadly playbook that takes the thousands of cases of protocols, and it starts with the doctor who says go home and do nothing, and you end up in the hospital, and the isolation and the push for these drugs, and so on and so forth, unto death, right? There's 25 tactics that became the hospital's modus operandi in how they did this. And so this is what we saw. So let me ask you, because I know we're getting short on time, what needs to happen this is a two-part question. What needs to happen, in your opinion, to change the healthcare system and restore the trust and protect patients, because patient safety should be number one, And what can organizations like Betrayal Project USA and other organizations that are in the medical field do to help good nurses and good medical professionals fight back and maybe even come out of their silenced compliance?
So I just want to add one thing that they did during the mandates and no one really talks about. You remember when they had shelter in place?
Mm-hmm.
Yeah.
So I just had from this remote job I had where my vitamin D level went on critical because I couldn't even get my breaks. I was not even getting outside
Yeah.
for like barely the week coming down to the end of this job. And that sent my cortisol level through the roof. And what happens with the cortisol level through the roof? Your blood sugar gets
Yeah.
higher, right? So then, to add insult to injury, this I only discovered this just recently. The reason why they were insisting to stay inside, don't get any sun, because that affects your immunity, that
Yeah.
affects cortisol level, and so with every single person with with COVID having super high blood sugar, and then not having vitamin D and your cortisol level increasing even more, the prominence of clots were even more
Yeah.
enhanced.
Right.
It's diabolical.
Yeah.
And I just need to put this out there because a lot of people have not connected dots with that, but it's a cause of a lot of depression as well, a lot of suicide. And I just want to, before I go into what they need to be done, I just want to recognize this group of people, young people and old people who committed suicide due to the sheltering in place. There were many who lost their lives with suicide during the early days of pandemic when you weren't allowed to go to school, you weren't allowed to have visitors, you weren't allowed to congregate. Many people killed themselves in depression, especially young people and people in skilled nursing facilities. I was a hospice case manager during that time, and I walked into the room of this old lady who was a social butterfly, but she was isolated. I walked in to see her with the partition curtain around her neck trying to hang herself because she was so depressed and lonely.
Yeah. My father.
The people who died that way during the pandemic that no one is talking about. So what I feel should really be put in place to make things better is legislation in place to protect people like me, doctors, nurses, any healthcare person that has had to, speak up and had to be, persecuted so much. I remember I tried to put together cases to file lawsuits and nothing would happen. I would be ghosted. I could not even try to get justice at that time because everything, the whole system was rigged to protect the people doing the crime and to persecute the people who trying to do right.
Yeah.
So we need things put in place on a legislative level to protect whistleblowers, because it's just a big sham show that every hospital, puts on paper in their little binders on orientation days for new employees saying that they're protected.
Right.
Okay, and the hospitals without unions were the ones who just were able to do whatever they wanted because there's no one advocating for staff as well. It was not just patients affected; it was staff. There's so many nurses on disability who cannot work anymore because of vaccine injury, and they're living hand to mouth in poverty. They have been given a runaround and said that they have anxiety, or they have this and that. They blow them off when they try to say this is vaccine related. So all these people need to have things, you know how they change billing and they change stuff in insurance? You need to change it and put in place things for vaccine injury so that they can get covered for treatment.
Yeah.
That needs to be done.
I would agree with that. I think that I think it should come from big pharma in terms of
we need to lift that vaccine injury protection that they have.
PrEP Act, yes.
We need to lift that and
immunity.
give it a death toll to that, and then they're going to start having accountability for the crimes against humanity that
Yeah,
they've done.
I think if you take away their immunity,
Yeah.
they will police themselves, because they only do this because they have immunity. And I
And
say it all the time. Yeah.
because they can get away with it. That's the whole thing.
If any group of people the only people who doesn't have immunity is us, but like we didn't have immunity, but if anybody, if one group of people has immunity wherever they are, whichever group that is, we're all not created equal, are we? Like, we all have to be, nobody's above the law. Well, okay. Thank you for having the moral courage to speak out, first of all. And I appreciate you coming on. We went a little bit half hour over what we normally do, but that's okay. It was important information to get out. And so I hope you will, we do an X Spaces every Saturday afternoon, and we talk about these topics. And I hope if anybody who's on X will follow us at betrayal_PROJ. Follow us.
X, by the way, it's Nurse Rena 2023 on X.
Nurse Rena 2023 on X. Okay, we'll put that in the show notes too, so people can connect with you. Yeah, I hope you'll come on and talk more about this on some of our spaces, because it's we have a far reach on X, right? So
Yeah.
it's a bit more. We can reach a lot more people, but I do appreciate. Appreciate your time. And I'm just going to close by telling people, go, if you have a story, shot injury, or protocols, go to betrayalprojectusa.org and put your story in. And so, y'all, you've been listening to A Nation Betrayed, Unmasking the Hidden Agenda. It's a production of Betrayal Project USA. Me and Heidi are both founders of Betrayal Project USA. So to hear more stories, to learn about our mission, to join us, to volunteer, to get involved in fighting back against institutional betrayal, visit betrayalprojectusa.org. Together we stand for truth, justice, and the fearless fight for true freedom, to protect our freedom, because a nation that hides the truth truly betrays its people. So thank you very much, and we'll see you on our next episode.
Thank you, ladies.
Thank you.